Now we're going to talk about screening and why it's important. Joining us today is Gina DeFranco, who is an osteopathic physician and family medicine physician with UT Family Practice. I think I got that all right. And she's going to talk about if you get the Erlanger magazine, there was an article in there not long ago about resolving to get screened. Why? Why is screening important?
Because screening catches things before they get bad.
Ah, all the time?
Well, not all the time.
I'm teasing.
But most of the time.
I know how things say today. Because I guess men and women, we all have a sense of, oh, we'll do it next month. Or I'll wait a few weeks and then it becomes 6 months or a year, and that could be bad.
That can be bad, because if we catch it early, it's easier to treat.
Is that with everything? You know, because you think of cancer as being one thing, but I imagine there are others as well, aren't there?
Well, there are others. The two important ones I think about that were in the article are hypertension and diabetes. Hypertension is high blood pressure, and you know, diabetes would be high blood sugar. And sometimes they go together, but if we diagnose them early, we can treat them when they're still easier to treat and before the complications develop.
Is it sometimes as easy as you just feel there's something not right? You know, you don't really hurt or anything like that, but things just aren't right, and then that, you know, 6 months later can be, well, that's because you've got onset of diabetes and things.
It can be, especially with something like diabetes. Most folks who have high blood pressure don't really notice it unless it's bad enough to give them a headache. But sometimes folks with diabetes will have symptoms and show up in the office with symptoms. The idea of the screening is to test you when you have the risk factors but may not have the symptoms, so we can catch it before you get to the point where you have symptoms.
So, in other words, it would behoove a person just to get a screening set for whatever reason.
Right. Go see your doctor, especially, you know, once you get into your 30s and 40s, depending on whether or not you're obese or normal weight, or you have a family history of some of these conditions. Your doctor will know whether or not to test you for diabetes and see what your risk is at that point. And then if you're negative at that point, meaning your blood sugar's normal, your blood pressure's normal, every couple of years you should get screened again.
How is a screening done? I mean, I don't understand. So
it just depends. For blood pressure, we just check it on your arm, like when you go to the doctor. Just check it on your arm. You can check it at home if you have one of those blood pressure cuffs.
Are those pretty reliable?
Yes.
Enough to at least
yeah, usually they are. And the ones at the drugstores is similar if you go to the drugstore and get it tested. Things for diabetes is more of a blood test. We draw blood, not usually pricking your finger like you think of with diabetes, but from your arm. And we test your fasting blood sugar. So usually that's done when you've been fasting for 12 hours. Same thing with your cholesterol.
Yeah. But you should have, I guess, certain things at least yearly, or depending, your physician could say maybe more than that.
It just depends. Usually we recommend annual screening for things like cholesterol, especially if you're high risk. But if the blood test is normal, then you could probably wait about every 3.
Yeah.
It just
what
depends.
about bone density scanning? Because I know particularly in women this is important. Maybe men as well?
Bone densities are a little bit more difficult. We recommend after menopause, about 5 to 10 years, especially if you haven't had any estrogen therapy, that you need to get your bone density tested. You might need to get it tested sooner, especially if you have a family history. Say your mom has osteoporosis, or your grandmother, or you had an early menopause. Say you had a hysterectomy at 35 or something like that, and they took out the ovaries, which are what produce the estrogen. That's what causes the bone loss when you don't have any estrogen. So that's something you really need to talk to your doctor about.
How can you treat bone density thing like that? I mean, if you find out it's not, is it one of those things where they take certain vitamins or whatever? Does that help?
It's always a good idea to take calcium and vitamin D for any woman really over 30, because your bone density starts to go down around that time. But really we use different kinds of medicines that can increase your bone density in addition to the calcium and vitamin D.
Good information.
Yeah.
Thank you for being with us today. By the way,
welcome.
If you would like more information, you can contact the number you see us put up so many times, 778-LINK, which is 778-5465. Resolve to get screened this year, right?
Right.
Very good. Thank you.
Thanks.
Now we're going to join Mr. Food in the Kitchen. You know why?